All right, you ready? Okay. Hi, everybody. I'm Dr. Arvind Ganesh, co-founder at SnapDx and currently pursuing a DPhil at the University of Oxford. We're really excited to unveil this new Ebola triage and patient education tool that we've designed with our Canadian team. Our motivation to do this was really in response to a lot of the panic that we're seeing in our own Western communities in response to Ebola virus disease, a lot of which is based on misinformation about the actual risk that people face for this disease, and also in response to the challenges that we're seeing on the ground in the countries being ravaged by this disease, where a lot of the frontline providers encountering the disease for the first time are people who don't have the necessary training to actually triage cases appropriately and decide which ones need to be quarantined and which ones don't. There's a lot of complex healthcare information currently floating around concerning this disease, some of it accurate, some of it not. And so we felt it would be very important to actually aggregate the best evidence-based practices for triage and patient education around this disease and put it together into a simple tool. And that's what we're proud to present to you today. The tool is based on the latest guidelines from the Centers for Disease Control and Prevention, and it is vetted by Canadian infectious disease experts, and it is designed to be very simple and intuitive, and it's freely accessible by any healthcare professional or patient worldwide. So if you were to look at the patient-oriented version, so if you were to click that you were a patient when you first entered the tool, we would just ask you two very simple questions that are high yield. And based on your answers, we would be able to tell you whether you were actually at risk of having the Ebola virus and whether you'd need to contact your local emergency care provider and proceed with further assessment and quarantine, or whether you're actually like most people in the Western world and at very low risk of being exposed to this disease. And in that case, the tool would actually remind you that you're far more likely to fall ill because of the flu this year compared to Ebola, and it would remind you to take your flu shot. On the other hand, if you're a clinician and you were to click on that option, you'll see again a list of simple questions that you can click through based on CDC protocols, at the end of which we'd be able to again tell you from a strong evidence base how much at risk your patient is of having Ebola virus compared to, say, some other infectious disease floating around, like the Middle East Respiratory Syndrome. So if you were to answer yes to the first two questions and no to the next couple, we'd ask you a question about travel to countries affected by MERS-CoV, for example. And so based on that, the recommendations that the app provides would change. But at the end of the day, what you can see is that in both cases, we're trying to take advantage of simple but evidence-based triage protocols for Ebola and other infectious diseases, which amidst the noise and panic and media hype, it's easy to lose sight of. What we're trying to do is we're trying to cut through medical information overload and get people the answers that they need fast. Through tools like this, we're hoping to bridge the information gap between the common person and medical experts, improving healthcare for all at lower costs. Now, we understand that Ebola is a complex problem, and Ebola triage that's accessible to all is one small piece towards a solution. But we believe that if we put our minds together as a medical community and as a health tech community, we can play a major role in helping with the response to this disease, both on the ground in Africa and also in helping improve the flow of information in our own communities in the Western world. We're opening up this tool to other teams worldwide who share our vision of empowering physicians and patients everywhere with high-quality health information, and additional modules and translations to a variety of languages are underway. We'd specifically like to give a shout out to the student teams that are competing this weekend at the Ebola Hackathon at the University of Oxford. Put your minds together. Please feel free to take a look at our tool and improvise, and we wish you all the best.